Hello, Vasant residents. Today we have with us Dr. Tapan Ghosh, who's from Fortis Hospital. And today on World Hypertension Day, हम डॉक्टर साहब से रिक्वेस्ट करें कुछ वसंत कुंज रेजिडेंट्स के लिए स्पेशल एडवाइस सजेशंस दें बिकॉज इट्स ए डिजीज स्प्रेडिंग आउट फास्ट इन अर्बन सिटीज. Over to Dr. Tapan.
Hello, I am Dr. Tapan Ghosh. I am the Director and Head of Cardiology at Fortis Vasant Kunj and Head of Clinical Research. Greetings on the occasion of World Hypertension Day. You know, every year 17th May is celebrated as World Hypertension Day by World Hypertension League, and this is to sensitize everyone about the blood pressure and the need for blood pressure control to live longer. So this year's theme is measure blood pressure accurately, control it, and live longer.
Live longer.
Yeah. So if you just remember these three points, then you are done.
Blood pressure is the main cause for hypertension.
Yeah. So blood pressure means blood pressure above 140/90 is high blood pressure. Normal blood pressure is less than 128.
Okay.
Between 120 and 139 is called pre-hypertension. And lower blood pressure between 80 to 89 is pre-hypertension. That means you are at risk of high blood pressure.
Okay.
Right? So if you a normal blood pressure also say 130, that you are actually pre-hypertensive by the criteria of European Society of Cardiology.
So what is more dangerous, high BP or low BP?
No, low BP is a blessing actually. Low BP is not a disease.
It's not a disease.
Yeah.
Okay. What do we do in Vasant Kunj so that we live healthy and we live long life?
See, basically, so you should measure your blood pressure, and you should know the number, and you also should know the body mass index. That means your BMI, weight in kg divided by height in square meter. You should calculate your body mass index. So these two things you should be knowing. Then you should do a blood glucose test. So fasting blood glucose should be less than 126, and after eating 2 hours or eating should be less than 180. And then you should do a lipid profile. Yeah. So if the lipid profile is absolutely normal, you should repeat at 5 years. If it is abnormal, that should be attended to. And the bad cholesterol or LDL cholesterol should be less than 100 for prevention of heart disease.
Irrespective of age?
Yeah, irrespective of age.
It should be less than 100.
Less than bad cholesterol should be less than 100. So hypertension, diabetes, body mass index, and you should not smoke. Should not smoke. Stop smoking.
Youngsters today are actually
already the air quality index in our country and particularly Delhi is really very bad, around 300. So you're already smoking actually. You're around smoker.
Passive smoker.
Yes.
Right.
Yes.
So what is the lifestyle like? Exercise is very important, or you can be at home and still be healthy?
No. Exercise is very important. You can be at home, but then in that case you have to do either treadmill exercise or static jogging or some kind of stretching exercise. Usually we tell that should exercise for 30 to 35 minutes, preferably 45 minutes. It should be isotonic exercise like jogging, cycling, swimming, or brisk walk, right? And it should be done at least 5 to 6 days a week. Or 150 minutes per week. Then you should do some stretching exercise and light weight to maintain your muscles, right? Yeah.
One more concept which is gymming up, So what is the age to go to gyms and do hard
I think
exercise?
it's overblown and too much hype is created. I think from the cardiac standpoint, weightlifting and becoming better and having a better physics from look point of view does not give you
biceps
increasing biceps doesn't give you better survival. If you're lifting weight, what happens is the heart muscle becomes thicker.
Okay.
So that is isometric exercise. Lifting weight is isometric exercise. What we advise is isotonic exercise. Isotonic exercise are jogging, cycling, swimming, etc. So not weightlifting.
Not weightlifting.
Yeah, weightlifting may give you bigger biceps, but it may not give longer life.
So it can be negative on the heart also.
Yes.
So
another thing is that should never take those dietary supplements advised by the instructors because many of them contains phosphofructokinase, and then they're toxic. They're toxic. Yeah.
So today we had Dr. Tapan with us, and he gave us few insight on how to live a healthy lifestyle. Yes, BP is the main cause of hypertension. अपना बीपी कंट्रोल करिए, गुस्सा शांत रखिए, एक्सरसाइज करिए, and we wish you all the best. And he doesn't want to see you as a patient, but he's always there to give you advice on yoga and how to live a good lifestyle.
And
he's been a
the last word is don't worry, be happy.
Yeah,
Thank you.
That's very important. Thank you very much, Dr. Tapan. Thanks.